right, so next we're going to turn things over to the Director of Prevention for the Saskatchewan Workers' Compensation Board, Jonathan Sherman, for a presentation called Make It Safe for Mental Health. Jonathan has worked in health and safety for over 14 years, supporting operations in Saskatchewan and across North America in the construction, mining, manufacturing, and post-secondary industries. He is a Canadian registered safety professional, and he holds degrees from the University of Saskatchewan. The Prevention Department of the WCB is comprised of safety professionals training experts dedicated to reducing serious injuries and fatalities in Saskatchewan. Welcome, Jonathan.
Hi there. Thank you so much. I guess today it's just Johns and Jonathans presenting, which I think is a wonderful theme that you've chosen for the conference, and I'm honored to be here today. Just assuming everyone can hear me, unless I hear otherwise. If you have any comments, please place those in the chat. I'll try to address them, if not during the end of the conference, at the end of the presentation. And with that, I'll kind of get started. Have about half an hour. I do want to apologize right away. My voice is a bit scratchy, so I might be taking some sips of my my coffee here just to make sure that I can get through the presentation for the next half hour. And want to once again thank the SCSA for inviting me to present. It's always a pleasure to speak with the construction industry and work with the SCSA. This is where, in fact, I got my my start. I started here in 2009 as a safety training technician about 15 years ago. So it's always a thrill to come back. All right, I'm sure that you've done a land recognition. One of the things I've been doing with my presentations, both internally and externally, is just trying to add a bit more information. And I wasn't able to see what you folks did for that, but what I've got here is just a map of the treaties that cross into Saskatchewan. And one of the things I like about this is that it shows the size of those treaties and how they're not just simply part of our province, but actually go across the Western Canada. Another thing I'll mention is if you have the opportunity to read this book, Clearing the Plains, it's a fantastic book in terms of documenting the entire process of colonization and the impact that had on Indigenous people through the beginning of contact all the way to present day. So if you're looking for a bit more education, I would highly recommend this book. You can get it at your library or you can purchase it, but it's filled with all kinds of stuff and really is kind of required reading, I think, for people that live in the province to understand the history of what has gone on here with our Indigenous partners. Today I'm talking about mental health. I do want to have a bit of a disclaimer. I'm not a psychologist, a doctor, a medical professional. I'm a safety professional. I would consider myself a practitioner of psychological health and safety, not an expert. So the information I'll be sharing with you comes from the experts, the psychologists, the psychiatrists, the doctors, the authors, the folks that have really researched this topic. That being said, I'll share a bit of my own experience as well, which is part of the purpose of this presentation. There's kind of two things I'd like you to take away from it. One is I'm going to share a few things that you can do right away that will help improve psychological health and safety in your organization, as well as I've got an ask for the group in terms of what we need to do to try to take the next step in mental health improvement in our province, specifically in the workplace. One of the things that I'll be talking about is leadership. Leadership is a big word. There's all kinds of definitions. There's a bunch of quotes that you can see on here. Some of them are good, some of them aren't. I find it valuable to make things very, very simple. Those of you that know me know that that's a requirement for me to understand things. So when I talk about leadership in the context of today, I'm really talking about, when you lead, you help others succeed. So if you're talking about psychological health and safety leadership, we're talking about you helping others be successful in that area. You don't have to be a formal leader. You can be a formal leader. You can be a people leader. You can be an ideas leader. But I think we all play a leadership role one way or the other at work. Sometimes our influence changes based on our position, but we're all trying to move forward with health and safety. And so if you're helping someone to succeed, you really are taking on that role of leadership for the intents and purposes of this conversation. Now I've got one of two polls. This is the one. If you zap it with your phone, you should be able to answer the question. It's a very straightforward question. That should work now if you have a chance to do it. But essentially, would you discuss mental health with your colleague or supervisor at work? So if you take your phone and hover over there, you should be able to get to a poll. It looks like it's working because I've got some results. I won't be able to show you the results, but I'll tell you them. Just a technical thing because I'm a bit slow with that. So looks like we've got about 22 people. It's coming in good. Just to give you a minute to answer that question. It's slowing down a bit. Yeah, looks pretty good. So what I'm seeing, and I will share, I'll share you the numbers right now as they are. So in terms of would you discuss mental health with your colleague or supervisor at work, we've got about 27 people out of 38 saying they would, 4 saying no, 7 saying not sure. So we've got about a third of people pretty confident they would speak about it, or sorry, 2/3 saying they would, and about a third saying no, which is fairly consistent with the research that we've seen out there. I will provide these slides too if anyone wants to actually see the references with regards to this research. But these two numbers I find really fascinating. 75% of people would not speak about mental health in the workplace, according to this research that's been done across Canada. But 76% would be open to talking about mental health if someone else is at work. So what does that mean? Well, it means we're not very comfortable being vulnerable about mental health or sharing that information at work, but we're okay with listening. We're okay with being empathetic about that. We will listen to people, and we're open to talking to them about it. So I think it's an interesting sort of environment that we're in, where we're getting more comfortable with mental health, but we're not comfortable with ourselves sharing that information or bringing that to work. And the reason is pretty straightforward. It has to do with this, right? It has to do with stigma. There's still a significant stigma around mental health in the workplace or in general. There's been a lot of work, a lot of campaigns to reduce that. But for the most part, we're seeing that sort of 75% of people in the workplace still are not comfortable but bringing it up. And the reason is their fear. They're afraid. And some of those fears are, they might not be promoted. They might be seen as weak. They might be seen as untrustworthy or unreliable, or they just feel that it's too personal. Lots of different reasons, but certainly isn't something that people are comfortable with, and that's a problem because mental health, particularly this mental health illnesses, before you can really improve, you need to get help from someone. It's very hard to do this on your own. You can read and you can get information, and depending on the severity of your illness or the type of illness you're dealing with, you can make improvements, but you need to ask for help. And it's not a visible, in a lot of cases, illness like having a heart condition or having a broken leg or something like that, where there's very direct medical interventions that you can do. With mental health, there's such a variety of different things that could be helpful, and a lot of them we don't know and need professionals. So without that breaking of the stigma and reduction of that stigma, we're not even really getting to the part of problem solving, which is, of course, how we're going to reduce mental health injuries and impact in our culture. So what are some of the things I want to talk about? I'm just going to briefly cover some things, practicing self-care and getting a little bit firmer definition about what that means in this context. I like to talk a little bit about a growth mindset, which is something that you can start doing right now that will help improve the environment within your organization. Making it safe for failure, both for yourself and for others that you work with. And playing through your mistakes. Again, making it a safe place to make those mistakes and to continue working. And then I'm going to share a little bit And that's my ask at the end of the presentation is to talk about how do we actually break that stigma at work and make it safe for people to come to us as supervisors or as colleagues to get help, which is really where we're failing in our programs. So when it comes to education, it's really, there's so much stuff out there. There's so many resources. SCSA has resources. You can see one of them here in terms of toolbox talks or accessing different organizations that exist within the province for help. Organizations like the CSA or the Construction Resource Safety Alliance have documentation. We have a training matrix and a program that we've attached to our fatality and serious injury strategy that's there to specifically focus on mental health. So there's no shortage of material. And one of the reasons I'm giving this presentation and why we've been focusing on this at WorkSafe is that we know the resources are out there. If you look at the other provinces and nationally and internationally, lots and lots of resources. They're just not being used as much as we'd like. And the reason we feel that that's happening, and based on what we see from the research, is again, stigma against sharing that or bringing it up at work. And so if people aren't asking for help, then they aren't using these resources. There's also a bit of confusion and fear, I think, in terms of employers, because it is a big topic and kind of maybe foreign to a lot of us. And it does take some education and some understanding before you can really change or implement things within your safety management system. So that's where some of the courses that we offer, other organizations offer on that sort of psychological health and safety 101 can really be helpful. Mental Health Commission has lots of great training, including mental health first aid, which gives you that sort of primary skill to identify when someone's having a mental health issue and direct them to the right folks. And that's again something to emphasize is unless you're a psychologist, a psychiatrist, a doctor, a medical professional, you really shouldn't be treating anyone or giving them advice about how to fix their mental health illness. Direct them to the professionals. And if you feel like you're struggling in some way, please seek medical attention. That's the best way to start that journey. I think there's also a need to kind of look at yourself and do some reflection and think about where you're at with psychological health and safety. As you know, whether you're a formal, informal leader, a parent, an employee, it's very hard to do your best if you're not healthy, and mental health is a big issue. We saw this through COVID. We saw how people that were, functioning very well within work were having a lot of trouble. And I think that's one of the reasons we're able to talk about it a bit more is because of that situation. So there's a psychological self-assessment for leaders. And again, you don't have to be a formal leader. You can access that through the Guarding Minds at Work site. And there's a link here. Again, I can share that. And there's also just that opportunity to self-reflect. Now, when I talk about self-care, what I would normally do is reach out and talk to people and say, hey, like, when I say self-care, what do you think? So if you're willing, if you want to go in the comments and just, when I talk about self-care with regards to mental health, what comes to mind? What pops into your head? You just type it, 1 word, 2 words. I'll see if there's a few people throwing stuff down. Nobody's saying, oh, there we go. Relaxation. That's a good one. Emery. Work-life balance. Yeah. Reiki. Anybody else? Getting enough rest. Self-compassion. That's a good one, Sarah. Rest and digest. I don't know if that's reflection or you're talking about your gastrointestinal things, but absolutely. All of these are great. One thing you'll notice if you take a look at the comments, when we talk about self-care and we bring that up, this is normally what happens. People talk about, they're talking about stress management, right? All these things are ways that we manage stress after it happens. So when I think about this from a health and safety perspective, it's like doing an investigation or doing a corrective action after an incident has occurred. That's right. You need to do it. You absolutely need to do it. You got to practice self-care. You got to take care of yourself. You got to do the stress management. You get the massage, do the things that help you relax. However, I'd like you to think about self-care a little bit deeper with your own, when you practice your own mental health maintenance. And this is a definition from the WHO. Self-care is the ability for an individual, family, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a health worker. So again, it includes the assistance from others. And if you look at the list of things there, you might have a massage therapist or your family counselor. You're getting help from other people. You're getting medical help from other people, and that's really important. The other thing is, when you talk about self-care, it's very important to manage the stress and the situations that come up in life. But there are actually ways that you can go a little deeper and try to prevent those stresses or issues from coming up or causing you to be to have a weaker mental health status. And there's a few references here. One is a book by Jonathan Haidt, who's a psychologist, and he really talks about three main proven, scientifically well-documented methods of improving your mental health, and that is meditation, cognitive behavioral therapy, and medication. So again, I'm not advocating either one of these. I'm just saying that as a professional psychologist, these are the things that through the research he's seen have been really effective. So meditation can be very simple. It can be breathing exercises, can be taking that time in a quiet space, reflecting. What you're doing there from a neurological perspective is you're giving your brain a chance to rest. So your brain is always firing neurons, and there's pathways being activated. And when you're anxious or something like that, you're firing a lot of neurons. And so when you take a rest, when you meditate, when you focus on one thing, you just calmly breathe, you're actually giving your body, your brain a rest. It's similar to sitting down after going for a run, but for your brain. Cognitive behavioral therapy is something I've practiced and used both individually and with therapists, but that's about taking what is created in your brain. So your brain creates neural pathways with each thought. So you can think of a neural pathway like a little river being formed in ice. And the more you think about something, the deeper that river gets, right? So it's easier for the water to travel in that crevice if the crevice gets deeper. What cognitive therapy does is helps you to rethink and change the way that you think on a certain issue, so that you can create different pathways within the ice, and so that thoughts will naturally go that direction. So if you are the type of person that every time you're faced with conflict at work, for example, you get really upset, cognitive behavioral therapy will help you to rewrite that response and change that initial thought of like, I'm really angry, to I can handle this, or something like that, right? But again, it's something best done with a therapist, a practitioner who understands this. You can read books and do it on your own, but I would recommend, certainly, if you feel like you need some support, to go to a medical professional. The other thing I've got here is from NICAB, and it's the trauma response model that I've used as well. Now, trauma, there's all kinds of different definitions and use of trauma. Essentially, it's something that is kind of within you that is triggering automatic responses that you might not want. So for me, if I'm in a conflict situation, I automatically go to fight or flight, which is called hyperarousal. And I don't want to go in that direction at work. I want to stay calm, and I want to use my logical brain to solve problems. So what this actually does, and with the help of therapy, you can try to increase what they call your window of tolerance. So you're trying to expand the level of what you can handle before you go into hyperarousal, which is that fight or flight, or hypoarousal, which is the freeze or fawn. And it's very, very, again, this is a scientific method. It's proven, and it's best done with a therapist. But an example of that could be, for myself, I'll give you an example. I used to really get upset when I got my socks wet. I don't know, it's kind of silly, but it's a good example. I go get ready for work, go into the shower, bathroom, whatever, and there'd be water on the floor. And I'd get socks wet, and I'd like, I got to change my socks. So I get hyper-aroused right away. I got to change my socks. And after going through experiences and doing lots of backcountry hiking and being wet, like for 12 hours a day, now I can hike for, 20 kilometers soaking wet. And it doesn't bother me at all. My window of tolerance for that is much, much higher than it ever has been. So that's kind of an example of how you can improve that response. So it's not necessary to rely on stress reduction techniques if you're able to reduce some of that stress and reduce some of that response. And again, this is something that should be done with, a professional if you're unfree of that. But if you're finding yourself kind of reacting to things really strongly and you don't want to do that, you might be benefit from this type of therapy. And then, of course, medication. And a lot of people don't like medication. I find it fascinating that people don't like medication because we take so much medication. I used to give the example of diabetes, but I'm going to give the example of like heart disease is another good one, right? If you found out from the doctor that your heart wasn't super strong and you needed to take medication so that you could live, your best life, no one would shame you or say, "Oh, that's a terrible thing to do," or it's going to change who you are. But when we talk about mental health, there's still a very, very strong stigma. In fact, I'd argue more stigma for the medication than the actual illness. And I'm not saying you should take medication, you shouldn't take medication, but you should work through that with your doctor. And definitely is something that some of us, me included, need to do in order to, live our best lives and be as available to folks as possible. And in some cases, it's requirement to live a healthy life. In other cases, it might not be. And there are other things you can do. But again, this is part of that whole package that you work through with a professional about what works best for you. And most of the time, in my experience, it's been a combination of all three or other methods that are necessary in order to, have a good quality mental health. And the reason I'm talking about all this is if you're going to have a safe place for mental health, you got to get yourself straight first. You got to focus on you. It really is about showing up and being able to function properly as a leader, formally or informally, before you can start asking that of others. Some of the tools that we have for your organization, of course, at WorkSafe, we have a whole program that we use to integrate psychological health and safety into your safety management system. We've done that with a few construction companies last year, and we're in the process of operationalizing that. So we'll be able to support integration of the psych health and safety 13 factors from the CSA into your safety management system. There's also some great surveys from Guarding Mind in terms of organizational gives sort of a litmus test of where your organization is psychologically, so you can target which areas you want to improve based on those 13 factors. So again, I don't have time to go into these, but please reach out or check out our website or check out some of the Guarding Mind stuff that we use. Now, one of the things you can do when it comes to making the WorkSafe, your WorkSafe safe for mental health is start thinking about and adopting a growth mindset. So if you're not familiar with this, it's a very simple strategy where the growth mindset is the idea that you can change, that you can improve. This is when you focus on process, not people. This is when you look at a situation and give yourself, are compassionate to yourself. Someone said that, where you think about the world and your journey in this world as being one that can change. A fixed mindset is where we put certain characteristics on people, like I'm stupid, or I'm not going to be able to do this, or I can't handle this situation. That's a fixed mindset. You're saying you as a person can't do it. But if you use a growth mindset, you would change that to say, right now I'm having trouble doing this task, or I need to learn more in order to be successful at this particular activity. Interesting thing I find with this one, and this is where I fail sometimes, is I use fixed mindset in a positive way a lot with my staff or with my family, where I'd say, you're a good kid to my child, or I'd say to someone, you're an excellent safety professional. And really that doesn't do the person a benefit when it comes to creating a environment of safety and mental health, because the moment you say that and they fail, now they're questioning whether they are that. And it becomes a question of self, that internalization of their mistake. And we don't want that. When we give feedback or we talk to people about things, we want to use growth mindset and say, you did a really good job presenting that information at the conference, or you're excellent at providing guidance to employers on hazard assessment. So that when they do go out and they do have a bad day or they fail, it's not inherent that they're a bad person or that they're not good at their job. It's that they just had, and they didn't do the process well. So thinking about growth and fixed mindset, there's lots of information out there that you can access. And I apologize for going quickly. I want to make sure I get through this in half an hour. The other thing that I really like, and I like to encourage, and I think is really effective in organizations, is the concept of playing through your mistakes And I learned this from actually our piano teacher that we have next door to us. She's a fantastic teacher. She's one of these like master teachers that can take any student and make them, perform at an incredible level. But one of the things she said was this concept, and I guess it's pretty common in music is a perfect performance. Now, right away, perfection, I get a little my back up because I don't like the word. But then she explained what a perfect performance is. So a perfect performance is when you prepare, when you feel confident about doing something, and you play through your mistakes. I love that so much. You play through your mistakes. So when you want to create a healthy environment for mental health within your organization, you have to be open to mistakes, and you have to encourage people to play through those mistakes and to continue on when they have setbacks, because it's going to happen. Perfectionism is one of the worst things that you can do for mental health in your organization. I've seen it firsthand, seen it in the literature. It really does create isolation and make people feel like they aren't good enough. And they're definitely not going to come to you and talk about serious issues if they're afraid of repercussions because they failed. That gets into kind of the idea of emotional intelligence. And if you haven't had a chance to read Daniel Goleman's book on emotional intelligence, I think you'd find it very interesting. And when it comes to empathy, I think that, he makes the comment that emotional intelligence is one of the most important things in terms of leadership and organizations. And I do agree with that. And having empathy is one of the keys to having a safe environment for mental health. So he defines empathy as the ability to recognize emotions and to share perspectives with others. And it's one of the 5 key components of emotional intelligence, and it helps build trust and strengthen relationships. So if you're going to get people to bring their issues to you, you're going to have to be seen as someone who is empathetic. Now, empathy doesn't give people a pass to behave inappropriately. Empathy doesn't say, oh, we can all just do whatever we want. Empathy is about trying to see what is going on with that person, being aware of, what might be going on, and being open and curious when you talk to folks to help them sort of find a way to success. Again, you're not going to diagnose anybody. You're helping them direct, but they're not going to come to you unless they see you as someone who will respond in an appropriate and compassionate way. I had an opportunity to speak with Dr. Heather Stewart last year, and she's the Bell Talk Research Chair out of I think Queen's University. So she's a world-renowned researcher on stigma, and one of the things that she came up with another 50 people and was published recently, I think October 2022, was how do we reduce stigma when it comes to anything, not just mental health, but the clearly emerging core findings in the forms of social context between people who do and do not have lived experience of mental health conditions is the most effective evidence-based way to reduce stigmatization. So what does that mean? She's basically saying that if we want to reduce stigma for mental health, we need to take people who have lived experience and bring them together with people who don't have that lived experience. So if you're one of those fortunate folks that doesn't have a mental health illness, you're cognitively normative, you might not understand, like, I don't get it. Why are you so upset? Like, why does this bother you? Why are you not able to come to work today? But by talking to people that go through this, we get a better sense. And this is the same sort of approach that we use for anti-racism, for any kind of stigma breaking campaign, is we need to bring people together who understand from lived experience an issue with those that don't, so that they can learn. Again, lots of good information. If you look up Dr. Heather Stewart, she's got all kinds of publications, and she's got a lot of collaborations, but her focus, her research is all about stigma. Coming to the end of the presentation, this is where I start asking you to do something. Ooh, it's going to be rough, but I want to make sure we're clear on what this means. So vulnerability, if you're, talk about vulnerability today, you have to talk about Brene Brown, who's, the world-renowned researcher on that. But vulnerability, in her definition, one of her definitions, is uncertainty, risk, and emotional exposure. Vulnerability is not weakness. It is our most accurate measure of courage. I think what's really important here is, in order to make a place safe for mental health, you're going to need to be vulnerable. And that's really important for formal leaders. The higher up you are in an organization, the more vulnerable you need to be seen, because that gives permission for others to be vulnerable. And that's what is preventing a lot of folks from asking for help, is they're afraid. They're afraid that if they ask for help, they're going to be seen as weak. They're going to be seen as unreliable. They're going to be seen as not being able to handle the job or the stress or whatever it is. So we need to share. And that's really one of the things that that I'm going to ask you to do after, is to think about how in your organization can you share your own mental health journey. And you may be the type of person like myself who was diagnosed with depression, anxiety, behavioral disorder in my 20s. My whole life, had mental health illness, got diagnosed in my 20s, started the process of improvement and have gone through many different medications, many different therapies, many different therapists. But all this time able to have what I would consider a wonderful experience in life, having a family, having a wonderful career, being able to work with great people, worked all over the world and North America. And it's not that it's not difficult sometimes, but I want it to be very clear. If you're one of those people that's out there that is struggling with mental illness and you're afraid to bring that to work because you're afraid that, they're going to see me as weak and I'm never going to get that promotion. I understand that resistance to it. And if your leadership, for example, the CEO of your company or the director of your organization is able to share their own experience, whether it's directly from them or maybe part of their family, we all have experiences we can draw upon. I think that's the real big movement that's going to happen in our province to get mental health in the workplace and to make it normalized, right? We need it to be the same as diabetes, heart disease, high cholesterol. It's got to be one of those things. For myself, it's just a matter of being born with this bit lower levels of serotonin and dopamine. And so I've got to supplement that with some medication, exercise, all that kind of stuff, therapy. And it does take a lot of work, but it's definitely doable. Now, there are situations where, people have mental illnesses that are completely debilitating, and those are very, very serious and need to be managed with a professional. And they may not be able to do some things that others can do, but that's really not the majority of us that have mental illness. A lot of us are depression, anxiety, those types of things, OCD or things that can be managed. And if you're wondering whether you can still, be successful or whether it's something that you need to hide or be shameful of, I want you to feel comfortable in saying that that's not the case. And if you're in a leadership position, you're going to need to share your story if you want to improve the psychological health and safety of your organization. There's nothing more powerful than the CEO of your organization standing up in front of you and saying, yes, I struggle with mental health. Yes, I've had to do this and that to improve it. And yes, you can be successful with that. And that's really, speaking with, the researchers, looking at the research, really what's holding us back in terms of improvement. We have the resources, we have the expertise, we have the medical professionals, we know enough about mental health, we have this wonderful CSA standard. But until organizations and until the leaders of those organizations create that space by being vulnerable, people aren't going to ask for help. And unless you ask for help, you're not going to get better. We know that. So that's my request, I guess, of those that, are on the call today is there a way for you within your organization to share your story? Or if you're in a formal leadership position, can you share your story? And if you do that, you're going to see, an improvement on resource uptake, and you're going to see folks come and talk to you a little bit more. So I've got the same question that I asked at the beginning, but I'd like you to vote again. Would you consider, or would you discuss mental health with your colleague or supervisor at work? Now knowing, some of the things that it could do to help improve mental health in your workplace. Give it a try, and I'm just going to see if the numbers are the same. I'll tell you. I see a question from Neil. Yeah, we have actually a psychological health and safety unit. Psychological claims can be submitted, and we work on those. We actually have a special unit. There's about 6 people that work on psychological claims, and the purpose of that is twofold. We usually start treatment immediately before adjudication because we know that that's very, very important. And we also, those claims aren't handed off as much as others would be there. We try to keep it with the same person. Hopefully that answers your question. I think there's some recommendations within the chat of books, like Boundaries, 13 Things Mentally Strong People Don't Do. Thank you. There's John. What else? Sandra, Jonathan, thanks for your presentation. Yeah, for sure. Any other questions, I guess, just regarding some of the things. So, I do have more slides, actually. I can show you. There we go. So just looking at the results now, some of you have dropped off probably because you've been like, who's this guy and why is he talking? So the results on the second one, pretty much the same. 1/3 of you are still not sure or would not speak about mental health in your workplace. But because there's only 20 people out of 38, I'm hoping some of you are thinking about it. Maybe that's part of it. You can also do another survey here that just kind of talks about, the presentation and any feedback. And if you want to reach out to me and talk or get more information about some of the things we have at WorkSafe to support you in this, please do so. You can go on our site, WorkSafe Saskatchewan, WorksafeSask.com, and you'll see our Psychological Health and Safety Resource Center, where you can connect to the training and all the resources that we've built over the last few years.
All right. Thank you, Jonathan. That was a great presentation and certainly a topic that becomes more prevalent in the workforce and life as time goes on.
Yeah, from one training technician to a training technician for a father. I do appreciate that. I don't know if they had basic training techniques when you were here, but it is something I've noticed. They give a presentation, and I found more and more that people are opening up about mental health and really spilling their hearts in those 10 minutes in a closed room with other people doing the same thing. So I think you hit the nail on the head, and I appreciate that.
Yeah, that's good. Yeah, we did have BTP back in the day. Yeah, it's been around for a while. It was a lot of fun. One of the best presentations I heard about was a guy who biked all the way across Canada with another guy. And it was I still remember that presentation, but yeah, it was really fun.
Oh, there's so many. I can't tell you how many times I'm in tears in this class.
Nobody made me cry. I got hungry. A lot of recipes. It must have been the time. It was just a lot of recipes. Like, how do you make waffles? I still use the recipe. Really?
Hey, last time was how to pick locks. I will never feel safe again.
Practical stuff.
All right. Well, thank you so much, John. I know some of you are getting ready for a break, so we're going to head into our first break. It's going to be about 10 minutes, but while you are on your break, we're going to be looking for any original or your favorite safety slogans that you might have kicking around. You can chuck in there in the comments. I know this one time, Mr. John, your name's Johnny. No, Johnny
Spock now. Right. We're moving John.
I'm John Johnson. Okay, all right. This is fun. I know one time you were in my class and you had a great safety slogan. So please share with the people, what is your safety slogan?
Yes, it was, I love the smell of safety in the morning. No throwback. Cinema gold.
It is. And mine, going forward, is check yourself before you wreck yourself. So we're going places. So enjoy your break.
See you guys in a bit.